This is a wonderful opportunity to present some tools and a case example. So all of us here are about to participate in a master class on dementia care quality. Not by me, I'm the opening act. We are going to be taken to school by Dr. Shari Ling. So my standing before you as a colleague of Shari's is a great gift to me. Shari's been mentoring my work for years on quality measurement, as Deborah said, and so to formally co-present with you is an honor. And my job as the opener is to inspire you. I'm going to move fairly quickly through materials that contain a fair amount of information for your reference, and then I will inspire you to get engaged with Shari's work regarding 3 important measures for dementia care. And these measures are, as you've heard a number of times today, number 1, establish a diagnosis. 2, identify a family caregiver. And 3, provide referrals and coordination of care. And you've seen these items described by many today, and what Shari and I both want you to think about as practice change leaders is this: how are you going to know that your health system is completing these key tasks? How will you measure the system's performance? And this is what my, and more so Shari's, talk will address. These are my disclosures. Special thanks to the Historic Dementia Caregiving Network for its attention to quality measures. And this slide is an outline of topics that I presented last Friday at the U.S. Health and Human Services. The link to those handouts and to a video presentation is at the top. And for today, I'm going to only speak briefly about the Quality Payment Program, the National Quality Forum's report on prioritizing measure gaps, a few measures from the UK's NICE program, and the Examining Models of Dementia Care report from RTI. And all of this will set up Shari's talk. So what are quality measures? These are tools that help us quantify healthcare processes, health outcomes, patient and family perceptions of care, and organizational structures or systems of care delivery. And this slide also shows the reasons or goals for assessing care quality. The reasons are to assess that delivered care is effective, safe, efficient, patient-centered, or as I will talk about in a moment, person-centered, equitable, and timely. And to help you understand why quality measurement is important, I'm going to tell you a true story about my wife's mother, Sylvia, who passed away 2 years ago from dementia. And Sylvia isn't a real name, but it's the name my father-in-law preferred that I use when I talk about her in public or when I write about her. And actually the story isn't as much about Sylvia as about me, what it was like for me to sit next to Sylvia and her husband and my wife during medical visits. Okay, there we were, Sylvia, her husband, my wife, and me at the neurologist's office. And Sylvia gets the news. Her symptoms have advanced beyond mild to the point where her condition meets criteria for dementia. She was given a diagnosis. This is today's #1 issue, to assure that a diagnosis occurs. Now, when this happened, it was early enough that Sylvia was able to understand her situation and know that she had decisions to make. It was whether she wanted additional testing, a medication for memory, or to participate in a research clinical trial. And she looked to us, her family, for help. Issue number 2, identify the family members or caregivers. The essential quality measure here is to name at least one key person, ideally a legal healthcare proxy, and put her or his name into the patient's record. For me, in that exam room, I had many thoughts about family. My mind actually went to my son and his cousins, Sylvia's grandchildren, 10 of them ranging from about age 5 to 22. And I began to wish in that moment for someone, a specialist, a clinician, who could help all those kids with learning about dementia, what it means, what it doesn't mean, how things will probably be different in the future with their Nana. And now today, years after Sylvia's death, there's not this type of grandchild educating dementia specialist that I imagined then, but there certainly can be, easily. And let me explain how, and this will take us to our quality measure number 3, provide referrals and coordination of care. So one of the quality goals for healthcare, as you see on this slide, is that it is patient-centered. And now many of you may be aware that there's a national discussion about whether to shift this terminology to be person-centered, which has a slightly different meaning. And for me, I like to think that person-centered means that the healthcare delivery allows us to focus on what matters most to the patient or person and her family regarding goals of care that may be part of traditional healthcare or may be more about a person rather than about being a patient. So for Sylvia, if she had been asked by a doctor or clinician, what matters most to you, she would have answered, my family, her family, period. She was the quintessential Jewish matriarch. One of the signs of her illness was that she became unable to deliver an exquisite Seder or Thanksgiving meal single-handedly for 30 people, which was commonplace for her long before I joined the family. And all of the grandchildren had witnessed this skill, and each of them also always got high doses of her private attention amidst this melee. And I saw this changing. I knew it would be confusing for the kids, and I remember when I was a kid and my grandfather's behavior changed due to dementia, and I didn't understand it, even though my parents certainly talked about it. So the way Sylvia could have gotten that grandchild educating dementia specialist is if Sylvia's neurologist or someone on the team had asked her a question like the following, and they would have had to ask it and then be able to act. And here's the question. Sylvia, the illness you have is serious, but we can manage it. It's likely to progress, but we can make sure that at each step you feel supported and able to continue enjoying life. Now, with this in mind, can you tell me what matters most to you? By this I mean, what do you truly enjoy doing? And what would you like to continue doing for as long as possible? I'm asking you this because we can shape your treatment for dementia based on what's most important to you. And I know that if Sylvia had been asked this question by her doctor, she would have answered, my family. We in the family knew it, and we did okay with helping this be her priority, but we did it ourselves, wrestling person-centeredness in among the help and care that Sylvia received over time. And if the healthcare team had put grandchild educator on their list for Sylvia, I think it would have happened. If my patient ever asks me for a grandchild educator, I know it will top my list for our team to make it happen. Providing person-centered care means matching healthcare goals to what matters most to a patient and her family. It makes complete sense for dementia care in the 21st century. But for Sylvia and for most people living with dementia today, there's rarely a clinician who's stopping to ask what matters most to you and how can we, the healthcare team, focus on that. Then when we get an answer, provide a referral and make certain to follow up that the referral takes place. For many of these referrals, they will be for standard essential items regarding other medical care, legal, or financial counseling, less likely for a grandchild educator, but whatever the referral, the key quality item is that there's a needs assessment done, referrals made, and then follow-up. So, here are our 3 high-level quality measures. Establish a diagnosis, identify a family member, and provide referrals and follow-up. You will see these again in a few minutes. This slide has the intentionally descriptive title of Physician Quality Reporting System, PQRS, update to merit-based incentive payment system, MIPS, and located in the Quality Payment Program, QPP. And this slide really begins my queuing up of Shari's masterclass. So the reason this slide is important is because the measures noted here in red are ones that health systems and practices can voluntarily choose to report in the MIPS system today. Specifically, measure number 47, the care plan, and measure number 281, cognitive assessment, tie to our two high-level metrics of establish a diagnosis and provide referrals and follow-up based on a care plan. This next slide refers you to a tremendous report in 2014 by the National Quality Forum, which describes the need for new measure development to comprehensively assess a patient, a caregiver, and a health care system's dementia capability. Dementia capability, as you've heard about earlier today, is a term used by the Administration for Community Living and others to refer to a region or health system's ability to provide services that meet the unique needs of people with dementia and their family members and caregivers. This slide shows 5 quality measures used by the UK's National Institute for Health and Care Excellence, otherwise known as NICE. These are all regarding dementia, and you will see antipsychotic medication use, which is a core measure within our CMS national partnership to improve dementia care. This is a measure that's worth considering for outpatients in your systems. Laboratory assessment, which relates to a high-level measure for establishing a diagnosis. Contact details of a carer, a named carer on record. This is the UK's version of our suggested measure number 2, identifying a family member or caregiver. And attendance at a memory assessment service is something the UK does that the US might consider, and I was very interested to learn about California's system of Alzheimer's disease centers. That's interesting to know. These next 2 slides are for your reference. It's regarding a report that the Health and Human Services Assistant Secretary for Planning and Evaluation completed in 2016. Katie Maslow was a key organizer of this work, and what's listed here on these 2 slides are 14 categories of dementia care framework components, and you'll see again that our highest level 3 recommended measures are 1, establish a diagnosis, and this is present in 1 and 2 on this slide. And here our measure number 2, identify a family member or caregiver, is related to area 9 of involvement, emotional support, and assistance to family caregivers, and providing referrals and coordination of care. Our 3rd measure is described in the dementia care framework component number 14. All right, finally, this is the slide you saw earlier of our 3 high-quality measures: establish a diagnosis, identify a family member, and provide referrals and follow-up. What I've added here are individual measures that will be included in the materials Shari will present. Specifically, regarding establishing a diagnosis, watch for Shari's discussion of the annual wellness visit and the ECQM, or the Electronic Clinical Quality Measure for Dementia of Cognitive Assessment. Under Identify a Family Member, there's an Electronic Clinical Quality Measure of documentation of a healthcare partner. And regarding the provision of referrals and coordination of care, Shari is going to walk us through the Improving Medicare Post-Acute Transformation, or the IMPACT Act of 2014, and the new 2017 CMS initiative titled Meaningful Measures. And with that, here's my contact information, and I hand it off to Shari.